So a confusing aspect that often patients are confronted with when we have the first initial consultation is that they come with a problem and they say, this is where the problem is, and it's painful and it hurts me. But often during the course of the examination, we discover actually that this isn't the real problem, that no doubt it's injured and it's painful and it's inflamed and it's the thing that the patient is most complaining of. But actually the author of the problem, the real cause of the problem, is elsewhere. And so it leaves this strange state of being where the patient doesn't really know whether the problem is here or whether it's over there. And the reality of the situation is that whilst we wouldn't deny that the patient is injured and the area is inflamed and it's painful, it often isn't the author of the problem. So one of the things that you'll often hear in clinic that we say is that this area isn't the bad guy. It's actually the good guy working really, really hard to compensate for a problem elsewhere. And that leads us into an important point, because really there are only two reasons in the absence of trauma why we actually develop a problem. Either the problem is actually in the hip and it's inflamed and it's injured and it's not moving right, and yes, there is a problem here, or the problem isn't here, it's actually elsewhere, but you're compensating here, and actually that's why it's become injured. And that point is really important to make, because if this is truly just the compensated area of injury that's injured now due to perhaps an injury in the opposite ankle and your weight bearing more on here, we can absolutely get you pain-free, we can absolutely help the hip. But if we don't address the ankle as well, then the problem is going to come back, because of course the moment you actually start walking and moving and nothing has changed, then you're going to compensate on the hip again, and eventually the pain will return. So one of the things that we talk about in clinic is the problem here or is the problem there? And as part of our clinical examination, we need to be satisfied that the area of injury is actually the problem. Because if we're not, then, and we discover that there's a compensated or a problem in another part of your movement, then the problem will keep coming back. So here or there is one of the first things we'll say, and one of the other things we'll say is this the bad guy or is it the good guy working really, really hard to compensate?